Hi, I'm Savannah. I'm going to be doing my IV piggyback. Hi, I'm Savannah. I'm going to be doing my IV piggyback skill today. First things first, I'm going to make sure I'm following my 11 rights, GPSP, and 3 checks. First things first, I like to go ahead and perform hand hygiene and put on gloves before I go into the patient's room, or once I'm in the patient's room. So I am going to put gloves on. I'm going to go into the room. I'm going to knock and identify my patient using 2 patient identifiers. I'm going to assess for any allergies. I'm going to ask the patient or check an allergy band. I'm also going to assess I'm going to assess the IV site that's already placed and make sure there's no redness, no complications, no problems, anything like that. Once I've checked everything and checked all of that, I'm then going to go ahead and grab my medication, and I'm going to check that it is compatible with the IV fluids that are going to be hung, and they are. So now I'm going to go ahead and prime my tubing. I'm going to make sure the clamp is closed, and it is. I'm going to go ahead and spike my bag. Doing this, I'm going to make sure I'm using aseptic technique. So I'll take this blue thing off, making sure that hub doesn't touch anything. I'm going to take the spike, making sure it doesn't touch anything, and spike my bag. Okay, so now in a real life situation, if I was in a hospital, I would lower my primary IV tubing bag. I would lower it, or I would place this bag higher than it, but I don't really have that option right here. I can't really do that, so I'm going to place them on the same thing, but I'm verbalizing that I would move the primary infusion lower than this secondary. So set that up there. Now I'm going to go ahead and prime my tubing, get all air bubbles out. I have a trash can here at my feet. That's what this is going into. I'm going to ever so slightly slide this off like that and hold it. I don't know if you can see. Hold it with my fingers like this, so no part of the actual connector is getting contaminated. So I'm going to open my line. Whoops. First, fill this chamber halfway full so we can get some liquid going. Making sure to get all air bubbles out, and I did. Push that lid right back on. No part of it was contaminated. So now what I'm going to do is I'm going to take an alcohol swab and connect my secondary infusion to my primary infusion. So what I'm going to do for this hub is I'm going to scrub it vigorously with an antimicrobial swab. So you really want to make sure that you get that clean. Okay, now that's clean, I'm going to take off that and attach. Okay. And now what I'm going to do is I'm going to open the line and if I was using a machine, I would have set the rate and the machine would know to just continue to give the medication per doctor's orders. The machine, like I could punch into the machine what I needed it to do and it would flow and do that. So while that medication is flowing, we'll just unclamp this for a second so we can see that both of them are moving. Oops, okay. Both medications are moving, so I'm gonna clamp that, but we'll leave that. The machine would take care of that part. I would set it to what the doctor's orders were, and I would, yeah. So then I would make sure to watch this bag. While I first immediately give that medication, I'm gonna make sure to assess the site. Make sure the patient's not having any complications or redness or any allergic reactions or anything like that. I'm going to make sure I watch the bag. Oops. I'm going to make sure I just closed the clamp because I didn't want to waste my fluid. But I would make sure I would continue to watch the bag, and I would check it periodically to see how the patient was doing and to see how full the bag was still. Once the bag was completely done, I would remove it. I would remove the bag. And I'm going to remove this tubing, the secondary tubing. I would then move my primary IV infusion back up to its normal height that it needs to be. I would discard all of this per facility policy, and then I would make sure I'm assessing everything about I would make sure I document the administration of the medication immediately, and then I would make sure I'm assessing everything about the skin, the patient's reaction to the medication, how the IV looks, and then I would remove my gloves. Perform hand hygiene again. And I would report and record everything that I've done, and then I would come back to check on my patient within 15 to 20 minutes to make sure they were still doing okay. Yes, and I would make sure to report and record.